You probably didn't know it, but if you live in Austin, you've been contributing COVID-19 testing samples when you use the bathroom. KXAN's Jacqueline Powell explains how researchers at UT are using wastewater to predict when we can expect spikes in cases.
Researchers have found the #1 way to track down positive cases of COVID-19 before symptoms start.
Everybody has to flush the toilet, so everyone is contributing.
Is by testing what's in your #2. Days before the virus might show up on a swab test.
Could potentially detect that viral signature in their feces.
It's a technique that's used in some countries to monitor polio outbreaks. And now, Professor Mary Jo Kiersitz is leading a research team from UT's Cockrell School of Engineering that tests samples collected by Austin Water several times a week.
So these are a couple of wastewater samples, raw wastewater samples from the South Austin Regional Wastewater Treatment Plant.
The higher the concentration of the virus in one of these liters, the higher the likelihood that cases will be on the rise in the next week or so.
If you can have a warning that an outbreak is coming, you can gear up your medical personnel and say, we can see that there's this huge spike. They haven't arrived in the hospital yet, but get ready.
And soon, the team plans to test more localized samples, neighborhood by neighborhood, collecting them from manholes to get a better idea of which parts of town have higher concentrations of the virus.
We see an uptick there, we could dedicate more educational resources. Or like in the case of polio, what they do is they'll say, well, this is where we really need to focus on vaccination of people.
Which she says will be the next step once a COVID-19 vaccination is developed. Jacqueline Powell, KXAN News.